Today's video we're talking about acquired anosmia. I've previously made another video on the genetic causes of anosmia, and the link to that video will be in the description below. So for those who don't know, anosmia is the lack of the sensation of smell, and for acquired anosmia there are various causes which we're going to talk about in this video. So one of the first ones is some kind of upper respiratory infection. So it could involve the nose or it could involve the sinuses, and it's the most frequent cause of anosmia. There's nothing actually wrong with the nerve or the olfactory tract, it's just there's some mechanical process which is stopping the chemicals reaching the olfactory receptors. So it's also known as a transport olfactory disorder or a conductive olfactory disorder. So there's no damage, like I said, to the olfactory tract. It's intermittent, so sometimes the patient won't have the sensation of smell, sometimes they will, and it's usually during a respiratory infection where they don't have it. But this is a key sign that the damage or the cause is due to the nose itself and not due to the nerve. However, if they have a persistent anosmia where all the time they don't have a sensation of smell, that's most commonly linked to some kind of damage to the nerve pathway. Another cause for acquired anosmia is head trauma. So this involves damage to the axons of the olfactory tract. It depends on the extent of the damage, and it can even also involve the cutting or the shearing of the nerve depending on the type of damage done. If it's a fracture of the anterior cranial fossa, then there could be concussion to the olfactory bulb, and this is more serious, and in most cases it's considered to be unilateral or bilateral anosmia. And something to also know is occipital and temporal, so to the back of the head and to the sides of the head, is more damaging to the olfactory apparatus than frontal damage. Another reason you can have acquired anosmia is due to olfactory groove meningioma, and this is most commonly a benign condition and it has a very slow growth. So the patient will have a very slow realization that they're losing their sense of smell. It's usually unilateral, so the patient can still smell through one nostril, so sometimes they aren't aware. And the diagnosis is rarely through the lack of smell. It's usually when the lesion gets a lot larger and it affects other parts of the brain or other nerve pathways. So it can compress onto the frontal lobe and it can compress onto the optic tract. So the patient would have other symptoms like headaches and vision impairments. And I've also included here olfactory groove tumours as well, and these are also a cause of acquired anosmia. Parkinson's disease is another one, and it's one of the early clinical features of Parkinson's disease, and it's said to even occur before the musculoskeletal problems associated with movement, so it's one of the first early diagnostic signs. Another cause is aging. Just generally throughout the aging process, your sense of smell will reduce. Other causes can be psychiatric, so patients with psychiatric disorders will have distortions in their sense of smell. Other causes can be drugs, so things like opiates, anti-epileptic drugs like phenytoin, and immunosuppressive drugs. Also narcotic drugs as well, such as cocaine, can cause septal perforations, so you eventually have trauma to the olfactory nerve.